Hello and welcome to this edition of Safe and Sound. I'm your host, Doug Bolnick from the St. Charles County Department of Community Health and the Environment. On today's show, we're discussing subjects that we've all heard a little bit about but would like to know more. To discover this information, we will visit with a number of area experts. As natural resources are dwindling and trash landfills are nearing their capacity, many have turned to recycling as a means for help. However, do you know what materials can and cannot be recycled and where the recycling facilities are located in our community? To answer these questions, we'll talk with Nick Olson from St. Charles County's Recycle Works Central. A study by the Centers for Disease Control and Prevention reported that nearly 10% of high school students reported abuse by their boyfriend or girlfriend. Lauren Ruff from Bridgeway Behavioral Health will discuss the most common types of dating violence and present strategies to prevent this from occurring. After that, St. Charles County WIC nutritionist Fran Moody will explain the changes made in the MyPlate nutrition program that help us prepare healthier meals. On the news, we routinely hear about food-related illnesses occurring throughout the country. What you rarely hear about is an explanation of the behind-the-scenes investigations conducted by local health departments that control the spread of these diseases and prevent future instances. To let us in on this activity, St. Charles County epidemiologist Allison Tucker will discuss how her staff investigates a foodborne illness. To take foodborne illness prevention to the next step, Ryan Tilley, Director of St. Charles County's Division of Environmental Health and Protection, will offer preparation and presentation tips for holiday parties. But first, to provide a more detailed look into the mysterious world of synthetic drugs, St. Charles County Sheriff's Deputy Edwin Lutz joins me. Welcome, Deputy Lutz.
How you doing?
Over the last several years, we've heard increased usage of synthetic drugs. What exactly are those?
Synthetic drugs fall outside the typical street drugs but are related to them. They're two specific drugs, marijuana or THC and something that's on the street called ecstasy or MDMA, were researched in a lab, and different chemical analogs were made of those drugs under a research setting. Those chemical analogs were initially not illegal and available for research as chemicals, and they were produced out of the country. And eventually, through internet information spreading, people who had a different idea of how to use those instead of a research setting in a way to sell similar to illegal drugs began to purchase those chemicals and then manufacture them as synthetic drugs.
One of these manufactured drugs is the innocently sounding bath salts. What are some other types, and are any of these legal?
Well, that's an interesting question. There's a couple of different things at play. First, bath salts are sold under several different monikers. So you have bath salts, which was the original way that they were marketing something called a cathinone, which is akin to ecstasy, which gives you more of a high typical of ecstasy or cocaine is what it's usually spoken of as a similar high. That's also marketed as foot powder and glass cleaner and just really anything in different various stores. Most of those chemicals are illegal at the state level and local level. Some of them are illegal at the federal level, and there is a class of them that is not illegal. And the reason is because a chemical analog is very close, but not exactly a chemical. So as we outlaw a chemical, they make a new analog, and you're always chasing that new analog to make it illegal. And so you have local, federal, and state governments to continuously try to keep those outlawed. And so as we outlaw them, though, there are new analogs that come on the market.
You mentioned that people are doing these because they do get that high, but actually these things cause some serious harms as well. What are some of the bad symptoms?
The worst things that we're seeing is psychosis, especially with bath salts. And what happens with that psychosis is that people become, very mentally unstable. They end up in our emergency rooms, And the emergency rooms can do little to reverse that process. And what happens is they become addicted to a highly addictive substance that gives them a mental psychosis, and they just it's just not something that is that they recover from. And so, of course, that affects all areas of your life once you've entered into permanently changing your mental state to your detriment.
So what are some of the things that the Sheriff's Department and other law enforcement agencies around our community, and also what are some of the things that the general public can do to stop this?
Well, as far as the local and state agencies, we have a partnership. Our particular agency has a partnership with the federal government, and we're working hard to both identify the ever-changing ways they sell these products, the locations that they sell them, and identifying ways to keep ahead of the analogs as they change. The federal government has done a good job with an analog statute allowing them to actually declare things analogs of substances, and it's been effective at their level. The state government, we have an analog statute as well. And at our local county level, we do a good job of really identifying what is in our local market and making sure that that is outlawed. These particular substances are extremely profitable, and because they have about a 1,500% markup, they pop up in different locations all the time. And so what the public can do, if they notice a loved one or a child of theirs is using those drugs, if they can help us locate where that source is, that will provide us the best ability to then take law enforcement action. Right now we're getting synthetics sold in different retail settings all across the board, from gas stations to convenient marts to shops that sell what they deem as paraphernalia for tobacco, but is often not used for that. Those type of shops. But we also have people who are manufacturing it in their home and then selling it almost as an illegal street drug. So any of those sources that the public can help identify for us is probably the best way for them to make an impact right now.
Well, thanks a lot, Deputy Lutz, for coming in and your insight into this activity. In addition to reducing the amount of waste sent to landfills and improving the environment, recycling programs boost the economy. Next up on the show, Nick Olson from Recycle Works Central will discuss St. Charles County's recycling methods.
Items typically recycled are plastic bottles, jugs, cartons, paper, plastic, aluminum, tin, iron, and steel. Both centers are typically the same. Recycle Works West does do glass and we do not. We also accept household hazardous waste and they do not. Any other items that are brought to the recycling centers are basically the same. Paper, plastic, tin, aluminum, iron, steel, any kind of major appliance, electrical or electronic device. Recycle Works Central is located at 60 Triad South Drive, St. Charles, Missouri 63304, and Recycle Works West is in 2110 East Pittman Avenue, Wentzville, Missouri 63368. If someone does not have curbside recycling, they can bring all their recyclables to either Recycle Works Central or Recycle Works West, 8:30 to 4:30 Monday through Saturday. Our household hazardous waste program at Recycle Works Central runs Tuesday through Friday from 9 to 3 and on the last Saturday of the month from 9 to 3. When transporting your items to Recycle Works Central or Recycle Works West, typically you'd want to keep them separated by category. When bringing household hazardous waste to Recycle Works Central, you'd want to keep everything in a box and try to pack newspaper around it to keep things separated and nice and tight. At Recycle Works Central, the only reason you would need to pull into the garage is to get rid of your household hazardous waste. On arrival at Recycle Works Central, anybody that pulls in, an attendant will come out immediately and ask them if they need help. They would pull into the first bay, the hazardous waste bay. An attendant will come out and unload their vehicle for them. Everything else you could park in front and drop off at the self-serve facility. Some of the items that we accept for the household hazardous waste program is anything flammable, combustible, pesticides, herbicides, acids, bases, aerosol cans. We do not at any time accept latex, acrylic, or water-based paint. Those can be solidified and put in your regular trash pickup. If anybody has any questions about recycling, they can call 636-949-7900, extension 4273 or 4267.
Thanks, Nick. After this break, we'll talk about efforts to prevent dating violence in our community, and then look into nutritional changes on MyPlate.
A single ember that escapes from a wildfire can travel more than a mile. Get Fire Adapted now. Learn simple steps at fireadapted.org.
Welcome back to this edition of Safe and Sound. On today's show, we are focusing on seldom discussed subjects and taking a closer look at how they impact our lives. To help prevent cases of dating violence among teenagers and young adults, we welcome Lauren Ruff from Bridgeway Behavioral Health to the studio. Lauren, thanks for coming in today.
Thanks for having me.
So what are some forms of violence that predominantly affect teenagers and young adults?
The main forms are physical abuse, mental abuse, verbal abuse, emotional abuse. Financial abuse can factor into it if, as a young adult, you are living with your significant other, but you more see the physical, mental, verbal, and emotional abuse.
So physical abuse is obviously easy to see. What are some of the other harms that are caused by abuse?
Verbal abuse can break down someone's self-esteem. It can work to effectively isolate them from their friends, from their family, from any outside activities that they once enjoyed. The emotional abuse can tear down at their emotions. You think you're this confident person until someone starts telling you that without them you're worthless, or that you'll never amount to anything, and that's why you have to stay there, because they can take care of you, they can help you through this.
So if you yourself or someone you love is a victim of violence or some kind of abuse, what are some things that they can do to get some help?
There's always your parents or friends. If you're still in school, a teacher, an advisor, a counselor. You can always certainly go to the police if you feel it's severe enough, if you wish to be protected from this other person that is abusing you. There are also multiple places you can go online that can give you information or like numbers to call. There's the National Teen Dating Abuse Helpline, which is online and has a phone system as well. There's the Bridgeway Sexual Assault Center and their 24-hour crisis line. There is Youth in Need. There is Men Can Stop Rape. RAIN, which is Rape, Abuse, and Incest National Network. All those organizations help.
So we as family members or as members of the community, there's stuff that we can do as well. What are some of the things that we should look for, and how can we help the person that may be affected?
The biggest thing you can do is educate yourself. Educate yourself on what abuse can look like, what it can sound like, on the things that can change when someone is being abused. When you know those things, it's easier to spot and to do things in your own family to educate your children so that it doesn't happen to them, and so that they have the information to spread to their friends and to help their friends. Start volunteering. There are places you can volunteer at. There are walks and organized events that happen that you can be a part of. You just have to look for those and stay involved in those.
Thanks, Lauren, for providing this service to our community. Guidelines for a nutritional diet and how to plan a menu have changed over the last few years. St. Charles County WIC nutritionist Fran Moody will explain these changes and introduce the MyPlate system.
MyPlate is a new system that's been created by the United States Department of Agriculture, and it has replaced the food guide pyramid. The main difference between the food guide pyramid and the MyPlate is that they've made it more visually appealing so people can really see what a typical meal should look like, and a typical healthy meal particularly. I'll show you what a typical MyPlate looks like. There are several different things here. You can see that they have the fruits, vegetables, protein, grains, and oftentimes the MyPlate comes with a little side of dairy as well. And like I said, they're trying to show you the different types of food groups. and the different portions involved. A typical serving size of a common food is about a 3-ounce serving of meat, which looks like this, and that is a deck of cards, as you can see, so this puts it into perspective for you. Another serving is a 1/2 cup of grains, which would look equivalent to about a computer mouse. So this shows you what a 1/2 cup of spaghetti would look like on your plate. A typical serving of cheese is about the size of a domino, and this is what a typical serving of cheese would be. And that's 1 ounce of cheese. Peanut butter is about 2 tablespoons. This would be considered under your protein group, and it's about the size of a golf ball. Fruit would be about a 1/2 cup, and that would be a 1/2 cup of fruit, or you could, or that would be equivalent to a medium-sized piece of fruit, like this orange would be a medium-sized piece of fruit, which is also equivalent to a baseball size. A serving of grains is about a 1/2 cup, but actually a disc-sized pancake would be the serving of a grains as well, and that looks like this. A cup of vegetables is equivalent to about a light bulb size. So as you can see, this is what a typical cup of vegetables would look like. To learn more information about MyPlate, you can visit the St. Charles County Health Department website. You would go to the Public Health Division and then click on Healthy Living. Or you can visit the Choose MyPlate website at www.choosemyplate.gov. The services that WIC provides are nutrition education for pregnant women and young children, and there are certain income guidelines that have to be met. But to learn more information, you can visit our website or call us at 636-949-7402.
Thanks, Fran, for giving us a better understanding of this new system and for illustrating exactly what a serving may be. To learn more ways to improve your health, please stay tuned after this break.
The pain will not control us, because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.
Welcome back to Safe and Sound. I'm your host, Doug Bolnick. We occasionally hear about food-related illnesses through news reports. To help explain the process involved in discovering the sources for these illnesses, St. Charles County epidemiologist Allison Tucker is here. Allison, thanks for joining us today.
Thanks for having me.
One of your responsibilities is to track the growth and the spread of illnesses throughout St. Charles County. How exactly does your staff do that?
We have several surveillance systems that we use to track illnesses. One of the ways we track illnesses is by monitoring reportable conditions. There's a long list of reportable conditions in Missouri, and they include things like influenza, tuberculosis, hepatitis, E. coli, salmonella, just to name a few. So if any hospitals, doctors' offices, schools, laboratories see any of these conditions, they report them to our health department. And then our staff will investigate them. We have 2 incredible communicable disease nurses who handle the majority of the investigation. So they're collecting information, the demographics, age, address, where they live, gender, but also disease-specific information. So if it's something like salmonella, you'd want to look back a week before they became ill. Where did they travel? What restaurants did they eat at? What foods did they eat? What grocery stores do they normally shop? If they've been around any animals, petting zoos, reptiles. So all that information is collected and put into a database, which then I'm able to pull that data and track the illnesses and also look for any links and exposures. So that's kind of our main way of tracking diseases, but we also use a system called Essence, and that does syndromic surveillance, and I'll explain that a little bit. Essence is web-based, and it's real-time data, and it takes chief complaint data from emergency rooms. So if you were to go to an emergency department and tell them that you have a cough and a fever, that information goes into our system, and it'll take that chief complaint and put it into predefined syndromes for us. So it really just gives us an idea of what's circulating. Besides those two systems, really it's information coming from the public. It's a school that calls in and says that they are seeing rash illness in children, or a mother that says that she had a birthday party for her child and several of the kids are ill. In those two examples, we wouldn't necessarily find out about that through our surveillance systems, but the public calling in and letting us know prompts us to investigate that.
A couple of those illnesses that you just talked about being reportable are food related. They come from some of the things that we eat or some of the ways that we prepare the food. What are some of the most common food related illnesses, and what are some of the symptoms for those?
There's a number of pathogens that can cause food-related illness. It can be bacterial, viral, viruses, or parasites. Some of the common ones we see, particularly bacteria, are Campylobacter or Salmonella. And they're both diarrheal illnesses, so it would be mainly abdominal cramps, diarrhea, the symptoms that you would have with that. With Campy and Salmonella, they are typically found on raw poultry. So that's why we always stress the importance of making sure that chicken is fully cooked, washing your hands after handling any kind of raw meat, being extra careful with cross-contamination. So that's kind of the common bacterial foodborne illnesses that we would see. But one of the most common foodborne illnesses is actually norovirus. It's a virus. Most people know it as the cruise ship illness or common stomach bug. It's nausea, vomiting, diarrhea lasting for a couple days. With norovirus, it's not naturally found in food as the Salmonella and Campy that I just spoke about. It would have to be, in order to get it from food, the food would have to be contaminated. And typically the way that's done is if you have a food handler who's been ill and unknowingly spreads the virus when they're handling the food, and then you consume that. The important thing to know about norovirus is that it's very contagious person to person.
So if someone does think they get some type of foodborne illness, we don't always know what the actual cause of that illness is, whether it be the preparation or if it was an actual piece of food, a piece of lettuce or a tomato. What are the steps that your staff goes through to investigate a foodborne illness?
There's several ways that we can find out about a foodborne illness. We could find out about it through our reportable conditions. So if we have an increase in, for instance, E. coli, and we do an investigation and find a link, and we suspect it's foodborne, that could prompt us, of course, to do the foodborne investigation. Or it may be a call from the public. It could be someone that said, I went to a wedding this past weekend and there's 50 people ill. However we find out about it, we have to act very quickly and gather as much information as possible. And there's a lot of people gathering information at the same time. Our communicable disease staff is going to be doing investigations. So calling people who are ill, finding out their symptoms, exactly what they ate, what they drank, what activities they did. And at the same time, we'd be wanting to contact a coordinator. So let's use the wedding as an example. If it was a wedding, contact someone who was coordinating the wedding. Find out the menu. Now we have a list of the food items. Get the guest list. If we get the guest list, we can interview more people. We can interview not just those that were sick, but also those that are well, and find out what everyone ate. It helps us in our analysis. At the same time, our environmental people will be going out and doing the restaurant inspection. And if there's any food left over, they can take that food and send it to the laboratory for testing. The laboratory is very important, not just for the food, but also for the people. If it's something like the wedding where we don't know what's causing the illness, it's very important for us to find out the organism. When we know the organism, then we know how it works. So all this information is being collected around the same time. It's being put into a database. There's constantly being analysis done on it, hypothesis testing. We'll change our hypothesis, more testing, getting information out to the public. And if If an outbreak turns out to be even larger, we'd be coordinating our efforts here in St. Charles County with the state and the federal level, such as the CDC.
If someone does become ill after eating here in St. Charles County, what would you recommend they do?
If they're feeling really ill, I recommend that they go seek medical attention. If they suspect that it's food, keep the food. Don't throw it out. Keep it in your fridge, because if it is food related, it's possible that we can test that food. But always call us at the health department. You can speak to any of the communicable disease staff or environmental division. And our number at the health department is 636-949-7400, and we'd be happy to help.
Thanks a lot, Allison, for an interesting look at how the health department investigates a foodborne illness. To make sure that your holiday meal is not the source for the next foodborne illness, the director of St. Charles County's Division of Environmental Health and Protection, Ryan Tilley, will speak with us about the 4 keys to food safety.
Some general safety tips for preparing meals during the holidays are to try to help prevent foodborne illness. You can do this by following 4 simple steps: clean, separate, cook, and chill. Clean means to clean your utensils and wash your hands thoroughly before using your hands to touch any food or any kind of utensils for touching your food. To separate means to separate your raw food from your ready-to-eat food. So your ready-to-eat food includes anything like bread, lettuce, tomatoes, lunch meat, things that are already cooked and prepared and ready to serve. So you can do that in the refrigerator, in the freezer, in the pantry, anywhere where you store your food. You have to separate the raw food from the ready-to-eat food. Cook means to cook your food to 165 degrees for poultry or chicken or turkey, but then also any other types of food, to make sure you thoroughly cook it so that you kill any pathogens that might be growing inside the food. And you have to use a thermometer, a probe thermometer, to test that temperature so that you know that it's a safe temperature. And chill means to put the food back into the refrigerator within a couple hours of having it out. So you want to make sure that you are preventing foodborne illness and that you keep the food out of the temperature danger zone. So the temperature danger zone is the range of temperature between 41 degrees Fahrenheit and 135 degrees Fahrenheit. If you can keep the food out of the danger zone, then you can help prevent bacterial growth that could lead to making you sick. Some general safety tips to thaw food is to use one of the 4 acceptable methods for thawing. The first method is at 41 degrees Fahrenheit or less, so that would be in the refrigerator. So if you have a large turkey of 21 pounds, it could take you up to 6 days or so to thaw that turkey. Another way to thaw food is to do it under running water. As long as that water is around 70 degrees Fahrenheit and it's constantly flowing, you can do it in the sink under running water. Another way is in a microwave, as long as you thoroughly heat up the entire part of the food. Sometimes microwaves tend to have hot spots and cold spots, so if you can heat up the entire thing without cooking it, then that's an acceptable way to thaw. And then another acceptable way to thaw is as part of the cooking process. So you go straight from the frozen state to the cooking state. So like if you're cooking brats on the grill, you can throw them right on the grill from a frozen state and cook them all the way through. And then other types of foods, you could do that as well. When transporting food for the holidays, it's important to remember to keep your food at 41 degrees Fahrenheit or 135 degrees Fahrenheit. You don't want to keep it in that middle zone, because that's called the temperature danger zone. The temperature danger zone is where pathogens grow the fastest and where foodborne illness is more likely to take place. So when you transport your food for the holidays, make sure that you're keeping it hot or you're keeping it cold. And then once you get to your event, when everyone's done eating and you have all this leftover food, don't leave it sitting out on the table, because that could potentially grow some pathogens and cause a foodborne illness. So what you can do is put that back into the refrigerator, get the temperature to drop. If you're unable to do that, or you want to leave it out on the counter for a while, that's okay, as long as you don't leave it out more than 4 hours. Once you hit that 4-hour time mark, you need to throw the food away because you could cause an illness. So let's talk leftovers. When you have a lot of leftovers, how long are they good for? How long can you leave them in the refrigerator? A good rule of thumb is 7 days. You have up to 7 days to discard that food item. If you go over that 7 days, you're more likely to cause a foodborne illness. 7 days is what we tell the restaurants. That's how long they have to do it. So it's a good idea. If it's a good idea for the pros, it's a good idea for us to do at home as well. Now that's for safety. There are also concerns of quality, which are a completely different category. If you're talking about quality, you typically want to eat that food within 2 or 3 days before the quality starts to plummet. When you pull them out of the refrigerator and you want to go to reheat them, you want to make sure that you heat the food back up to 165 degrees to kill off any pathogens that might have grown over the past few days. If you do have food in the refrigerator that you know you're not going to be able to get through within the 7 days, you could always take that food and freeze it. Freezing it won't completely kill any bacterial growth, but it will slow it down so that you can go back in and thaw that product and eat it at a later date.
Thanks, Ryan, and thank you for taking time to join me for another episode of Safe and Sound. We'll see you next time.